Okay, but anyway, magiging sa mergid rogo solang elatsis sa ngong deludor kuk namo set time update trap while giret tial COVID-19 ma mo mamay kung sa kafar emang mo introduce sa guest sigit. O lang to besta at ang haril berado de kalmar participate to ring asulir di blo lo kung gedra pe Wednesday. Okay, at this time ko mamay kung sa kafar ang mura program gidira kap sa kafar.
Madalwan siya malungil ko sa tulik.
Say,
Mr. Diaz, magsubay sa korat taligi bil smela tret.
Ali, COVID?
Hindi ako, kung nasa na
Okay.
Hindi, iman ba nga sulem ra teal buk sa mam na banggemel nila talk show git. Kapten mla duli ang relbela magidi o banggemel ba nga sulil dire ra bekkel ang edelurio at tamal lolo banggemel buk broadcast ra Eco Paradise mo kuman sulang.
Okay.
Tuli ka talk show git al week pataligi bil regular, I would say, ngat-ngat tali Dr. Dela Cruz sa bukro sa elme bang gedel al-gapsingay optimum sa tara kuha na diyo maklat karbeklat kata kuha mla mo taligibid complacent kata kuha mla mo smart akuk routine ergidel oy nga niya pandemic ra bulula na maygal Baliwag kergita tubo niya belura kwa mamal kora tubo dere lang terrak tegi da malmol mal kora selba aklandi again ako tadi kautlat ke kaingesew kada gitalo mesa ga idel bu kora indirect effect the pandemic.
I see.
Amo ngonge telang ninth month.
Something like that.
Something like that on 10th and 9th since I'll declare the public health emergency of international concern. Way back na wala lara mong ngora mal meo de tulik seldom das suringi di seldom es ang maral koram lamo mal mebre del momrek tial 2020 mo da mal di utakang le di kauklat kaya kayo sew hopefully kada malamol selba akal mesang elections il mobreg o mesagan maraming holiday.
I see.
Pero ko kita ko gidel sa gidel vaccine na COVID-19 vaccine hopefully hindi nagsela telal buy la kada ba gidi Imring Sulila Dr. Dela Cruz. Thank you Dr. Dela Cruz for joining us again. Sel kora educational segment tamal di mortuy regel al-tadaan al-merigidel al-khusus. Sel bol merege kada mga similar talk show kita open our line mura angel contact caller el mal lebla kanung Lorenz sa kada loger sa gidel gere malungi la price al wig among i mal liter beklado lo se bol se del tunin e Lorenz sa gidel ala Dr. Dela Cruz ya bol mere kada loger sa gidel question hindi aware sa kada mo of course kada mo stira adrablo update tra to rabrior el bol beskida retail uduin yang atiang lo mangala adon men yang PIO seguida ko kora mo telela talk show gida al Jesus
okay
o kuning itra reader mel beskida update sa edol mo
okay
mino kan tenge tuliya
gelo sangay
so kora ay nakata update tra telela reor mga kabawu ala quarantine pilay gitil Lara quarantine site on the 28th sa last update talaga na last week tinigam lo sa wali ng tester sila Monday Eli tumlo tester Eli tira 28 tilaw daw result tira 2,000 matigay gidal rohun na negative matumle release dal mura abalo ela tinigay mumudaki magtirigan le 8 dalbuk le tester sila weekend del military man wal 36 magtirigan rule 36 ang lang update tayo wal 14 days el mandatory quarantine or tira a quarantine site lahat na release di na kalora di mo talaga kasi matali ingara self monitoring al several more days el motor return al me malay el final testing al still al mo complete quarantine period ay sige dal dulasan 21 days.
I see.
Mang waise tirige email kimomitra tastil ngariar bibir tilal ngara medical field at ngara met timo at azul wasing ngara ngura sagiri long theory del girel el tongoni ngariar ada ngariar members still el other aware EMT ng emergency medical technicians magtadira kalkura offer and sorry marula kura refresher courses mura singal EMT singal other fire singal lumakal ambulance singal ngara ala free hospital care magimo at adu and then possibly set up a training kura di refresher courses and more still gigil al agat kira kalsira era la me gible ada dual kira la kura wal hazmat refresher course pila sa hazardous materials magigi da dire kal gibo mo sa dra klubuk sa kindi to makada waise kada smaga after maral November el año kada le announce kung da sulas tindiya kamot al flight al Kogi, al Mayor, al Sela October. Dito ka ito ko wasing nga niya Kogi nga Taiwan al Mila 25, ang niya wasing nga rin al Mila 28. Hindi meta bakit taktil al wasing niya ka Kogi, al Malmo Endara mo October 21st.
I see.
Nga ni Tahidil by Kogi United Airlines, November 1 naman 2. Say Mayor Ferry in live out. Say dia kalor takarar adal May, hindi bayo takarar adal al tuog dal maral tigil buklamo. Posori re kiril maral mo tuog dal belaw.
I see.
Dia ka testing al game offer ngil al time al kiril outbound rogul adal mo maral. Dia ka necessary bilolaya a COVID testing. Lengoy tiya ide tulik. Sa matagayal wasi adara kwam at tagaluriore mas recognize belaw wasi biya ka COVID cases ni mang biya require adal ngar belaw total mura kwam el test biya require test ra COVID-19 in order mo so is para mura kwam al sum ngar belaw mo.
I see.
Mang wasi idea direct kal Hawaii ang ari sa del BS ora kaiden certis elul tabdi el dire la testing al mura Hawaii al sumbo mo mel Hawaii ngari ay el talut al Bali al provider sa idil test al accept niya sa Hawaii yay lava dire clear certified Tinggal wasi ala bergi terbela, wajah clear certified, membuat orang upgrade lah mai lagi dalam COVID testing kita awal kurang dili away for ni ara CDC dan sampai perform ay lagi del PCR machines. Biyahal Hawaii, biyahal accept, biyahal mo makita mo dili, biyahal accept COVID test results rakwam. Biyahal accept yele test results ra at belaw mo agami test mo results ni belaw el mo Hawaii biyahal accept ni. Ang ligiri ra agal maral mo Hawaii kan mo kalabong sa mo quarantine. Lultoy ra ni sa gid PSL regulation malubing guidance ra kalura Hawaii.
I see.
Ang pira kal dili mo ay salwasing kal pira ramal legiral mercy ang ding lawas tal gibal masa magpasi ko ay sa gal COVID was November 5 en ngarangiya wal pura test flight loro laringiya FAA Federal Aviation Administration say kung annual lo tog daras ko ilmet gal runways airport trigal balul kita partneri matal regional gid at yang maldi may touch and go matadi we 3 crew member matila maldi may lendra runway and mutal so kal maral ya kala verto raskogi mandi kal required tir mo quarantine tamal di beses tra runway o kung mo tamra pasu maraga rongsi askogi say the November 5 e volo de wasing say the skogi ra FAA el di memra le ka other next mera
Okay.
ngaringi adira kal skogi ra November 7 na el poragim dalo ko mamma ar adra US embassy el ngaringi sterul tia military plane al may loltar sterul soldado military tirigel me tomora quarantine tomor say yung bander or say el 14-day mandatory quarantine tiraga nga me el mo continue a reor manuven discussion al aula bu el seral main secretary la navy ma tiraga marani ako ramle sorry el mera el alweek di ko ramle ko to ar ko lalingit ko lalingit ra se me eta talibal pusher ni el mo el sela alela o trimatal bu la November para seguir el tomar adra quarantine malame el sabaril el gora dicterum el manager wala reol so seguir en garia wal gora ko kill tentatively military plane al amir seguir
I see.
Kita malamol mang mongaria charter flight al mora Taiwan al maralmel long trimatal bu la gini ko message sa igil day talwasig malmuoy ngarang leng jakal ngarang kada direk kalmingi ler tirgel nura at Taiwan mauguro ler mo mereka quarantine ler mo mereka aguro ler stire min sabihin mo talgibel bato kal aga return al bay
I see.
lagi direk kal kampala medical referral programa akampala kis tirgel kuk gihil mo raw guro ler mo total maran mo Pastel bol kal tukla sa igil day talwasig maloy ngarang askoti yang kis muktalo ay sa sen po do talk show ya kaya ay sa murag lumang tamo na tingin.
I see.
So sa igit ya kata matingi tuling akal ako mesan news ra atara akwa mal tamal struggle or still COVID-19 maliga halbol sa barilan pura mungil wal pura manager ni el silseng wal 48 is el positive cases lamas aldisirar adal mlamo o 77 ngariya stero ngal mlata el alsil sarakwam akwam memorial hospital lamal tukar smel ngarini te 83 ar new year el all time 83 new year ya 12 vertira ngara ICU ya 5 ngara ventilator dirang kalnganya 2 new year ngara sele US Naval Hospital, mangaryawan ng New Year sa Guam Regional Medical City, mawan ng ngara ICU, kaidel, wan ng New Year, mawan ng ngara ICU. Wal bergula sira walele tora una mesa ni wasit tige rogul COVID amorawan ng ospital, Guam Memorial Hospital. Ya resta dia COVID amora ige bebira ospital. Hindi al time yung wal blood bola ka non-COVID hospital rabulu rakwam gerogul hospital geltril benal hospital ang arnya new yung ilis may era COVID so dira kan malgoram lo struggle at one time lo mira wase tiara kwa memorial hospital lo mira are non-COVID mar COVID patients leng mal masira kal anna mesra news ra PBN kanya siya singarabet talblad la ara tiale entryway mura emergency room mura gagi dale Guam Memorial Hospital etamla mo giri observation or other outside the building but the ngar curbside at nalo ay gagi dale deten makalamal di lulu mura lo kita ito mura atara Guam mutabiri mura mari dal manage sa actual situation na dili tamala
I see.
Kung wala din le gayikit ya update sa sabi ka provide yan so mga question tulig yan sabi ka rin.
Hindi ako question na katbay mal surprise yung siya aplura ko mal ngara albure lang hindi kita lamon ngora mo new norm elam teng namotel albur ngara tiu through ilbuy da do ay say gid mong ang namo korak sergi de sel ngara tabor ko mo ra taon mo shopping mar ko mo karang mo ko the first thing I do when I come home without knowing it, you know, namok sergita, natira namo more than 7-8 months ago I say, mangkuara namok sergita el malbala ima the distancing ansingergit, or mumgo remain the gaukat was the remain of practice the preventive measures. Mal seven directly help minimize that the other most COVID. I think we're doing okay. Okay. All right. Mike, I'm like Gormil.
Dira kal ku Israel al wasi PSS Rebellion 2 and tel to tingel wasi adra marinlo amlora Australia mo malani witar sel mo temlar tagi del bes amla me sois saba tirigay de rogul the 19 staff rap PSS Rebellion ultimo carterol Australian Navy akora advisors magta 21 na rokuy lengila ya tester tira COVID sira October 24 tuog del maral May mang elatam lam tirogul mla negative test results sir magta namin ding walgiri del pora kampit tagi del pora 10 days el quarantine mang arabara ministry la health amo masaradial de ramande el mo tester tir el provider seguir el wal initial el tester tir el alblal mira ablu kada lingitra agarablu lo asay hindi akadam de la sir kamal makatirat el dibus la motel al buil el dibus hindi do lingitra agarabli lo asay dil wal maklorendir el akadakora amo melamyak la el mo mesertir tirgar polisa malamol mal secure avasyo matirga ko ngaria around still masra te kora di mo maliwek pag di make sure hindi ka akora o ay gitel kora bridge and then sel la test ramande ya to so is para quarantine period still say gitel 14 days matirge akora protocol ra quarantine the blood el kas makliliri rawaset the test say gitel day 1 al Monday quarantine 14 days, test 14th day, sel mo number 14 seal, set the test, the negative, and then imlamos of irid berablu, book say the additional 7 days, self-monitoring.
I see.
Modia kata test, tira say the day 7, latawa wol kada talgi mo kora kada mo apply self applying mo ra ko amuana kada kora sila ko talme kada mo test tira day 1 and then the quarantine radial day 14 kada test tira and then move tra day 21
I see
ida wal kora mo process ma protocol el restrict gidel el agagal la return ng ara Australian base tirigan malmol malngar doctor say gidel ofra costa say gidel tangamalala ya tirigan gidel ar police ma arbibira police marino a provider of security
okay
tiga ante kakura kede tulik
dia mal everything is okay here
malaka kede huligit tamada buktab sa telila Dr. Bing
I say
to start just a reminder of the stress coping techniques, stress and anxiety, and how to general sort of tips on how to maintain sort of a balance, I guess.
Good evening, Mr. Diaz and our dear listeners. So I've been asked to talk about the relationship of hypertension and stress. When we say hypertension, usually the question would be what are the causes of hypertension? We can say it's from genetics or hereditary. It can be due to obesity, high sodium intake, or excessive alcohol drinking, smoking, sleep apnea, and physical inactivity or sedentary lifestyle. But one thing that's also a cause of hypertension is psychological stress, or psychological stressors. And the thing is, when we experience stress, we feel the physical symptoms like the palpitations and the increased heart rate or sweating, but we don't really feel the increase in the blood pressure, and it might be overlooked. But the thing is, while we are under stress and there's a need for the blood pressure to rise, when the stress is over, we expect the blood pressure to also come down later on. Mm-hmm. But the problem would be if there is a chronic stress that is happening. Because if there's a chronic stress, then it can lead to more elevated high blood pressure. And this could lead to heart condition. And of course, if it is a chronic condition, then it can also be a risk of having a heart attack or stroke. So hypertension causes morbidity and mortality. And so we should also take into consideration how stress affects our blood pressure. So with the hypertension, there's really no cure, but we can manage the hypertension or control hypertension by doing some of the things that, a healthy lifestyle. We can stop smoking, losing our excess weight by exercise. We can reduce our sodium intake, and we can reduce our intake of alcohol. Okay, and of course there will be the medications that could control hypertension. So we have the diuretics, beta blockers, some vasodilators. And the thing is, with psychological stress, we should be able to have good coping mechanism to deal with this. And of course, how would we address this? So we should, like I said, get some exercise, because exercise is good for the heart, and it makes us feel good when it signals our brain to release the happy hormone, serotonin, okay? So it makes us feel good. So we need to aim for at least 30 minutes of exercise a day, about 3 to 4 times a week, okay? So that will help us to deal not only with stress, but also with our blood pressure, and to reduce our caffeine intake, okay? Because it can also lead to high blood pressure, and it can also mimic too much caffeine can also lead to anxiety symptoms like palpitations, face sweating, and of course we could also develop, do bonding with our loved ones, because having someone to support us and knowing that there's someone who understands us and who loves us unconditionally will also make us feel relaxed and at ease and comfortable, and it can also lower our stress and our blood pressure. And as they say, humor is a good coping mechanism, so it can tickle your funny bone. Laughter is the best medicine, okay? And it can boost and make you feel better. So maybe read a good joke book or watch a funny movie, okay? But more importantly, get enough rest, okay? There's no other way to go around it. If you're tired, this can cause increase in blood pressure and stress, and you should rest, okay? And of course, get enough sleep. That is very important. And eat healthy. The proper nutrition could also help us in lowering our stress and our blood pressure. Okay, and the thing is, with when we say chronic stress, so there are lots of things that could cause chronic or long-term stress, okay? Like in terms of the occupational stress, it can be the workload, okay? And type of work that you are doing, okay? And if it's really a stressful job that you have, the more responsibility you have, then of course, the more stressful it is, then it can also cause you chronic stress and lead to developing hypertension. So what are the jobs that are high, that cause high stress levels? Okay, of course, those with higher responsibilities, but each job has its own way of, having or causing stress in each and one of us. Okay, so a good thing would be to know how to manage well your time in terms of doing your job. Okay, and to maybe not really work hard, but to make your work efficient and good and effective. And you must also know how to relax or have time out from your work. Okay? And with the current pandemic crisis, there's the social isolation that might be happening, especially those who are single or living alone, or are elderly who live far away from their children. Okay, so we need to be in contact, constant contact with them, remind them that we love them, we're here for them, because if they feel isolated and alone, that will lead to depression and anxiety, and it can also be stressful for them. Okay? And age also as a thing is related to developing high blood pressure. So that is one thing about that we should consider when it comes to our elderly. Okay? And there are also what we call the marital stress, okay, in couples who are not getting along well or maybe having issues. So of course, when they live under one roof, that can be a cause of constant tension and stress. So it can also lead to developing chronic hypertension. Okay, and socioeconomic status is also a concern. Because those who have low income, they might have less resources, and during this pandemic, as we have experienced, we need financial help, especially when there are people who are laid off from their work and who need to pay bills. So them not knowing where to get their financial resources can be a cause of stress, and if it has been going on for so long, then of course high blood pressure. Okay, and with the pandemic crisis, of course the uncertainty that's happening right now, and continuing stress levels that we are experiencing, even though we don't have COVID here in Palau. We know what's going on outside, and we're pretty much monitoring how things are going with Guam and Hawaii, and of course there are Palauans who have relatives there, and well, we also have relatives all around the world maybe, and we are very much concerned about them, and this can be a cause of stress. So of course, by being mindful, okay, we should be looking at the moment and appreciating the blessings that we have right now, like Palau being COVID-free, and we should focus on what we can do for our community at this point, and be thankful that we can still do some of the things that other countries cannot do anymore within their new normal because of the threat of COVID. Okay. So like I said, there's the relaxation techniques, breathing exercises help. Okay, the meditation, the mindfulness meditation, so it helps to make you feel relaxed and be feel less stressed about what's happening around us. Okay, I think that's it.
Dr. Bing, you mentioned sleep apnea.
Yes.
I actually didn't know what that meant, so I had to research and see what the definition of sleep apnea is. Can you just elaborate more a bit?
Yeah, I can share with you on that. I went to sleep apnea testing in Guam. They put you to sleep and put a computer all over you. And then go ahead and explain. I went through it.
This is common for those who are obese and those who snore loudly, So there's a point where during their breathing, during sleeping, there's a pause, and it can be a long pause, So when you're not inhaling for a long time, then it's causing stress also. And, and then of course there's the breathing center in the brain, and then it's activated. So eventually you will breathe, and it's like a sudden inhaling. And with sleep apnea, it has been shown that people can be stressed and actually not have a quality sleep, which means that when they wake up in the morning, they feel tired, okay? And that might make them sleepy in the workplace, and of course it affects their productivity. And just like what we said, it can also take its toll on your physical health, and blood pressure can be elevated also due to this sleep apnea. And just like, I think we discussed this before, and I think, Mr. Diaz, were you the one with the CPAP machine?
Yeah, I got a CPAP machine. I got it from Dr. Llanos' clinic.
Yes.
Well, I'm heavy too. I'm overweight myself. So what I did, I went to Guam and to see the military doctor, and then he told me that I need to go to a Guam Sleep Center, and they'll perform a test overnight. What they did, they put me to sleep, and all kinds of wires all over my body, and they monitor my sleep throughout the night. And when I get up in the morning, they show me a film of that. I stopped breathing about 8 different times. Completely stopped, and then I start breathing again, and then I don't. They told me that I don't get a full sleep. I snore a lot, and that keeps me awake throughout the night. So when I get up in the morning, I'm tired, like what you said. And so what they did, the CPAP machine is a machine that you put into your nose, with like how you said, it's like a cup, into you cover your nose and your mouth, and then that will help you. Like when you stop breathing, that machine will push air into your nose and start your breathing system. So I have to wear it every night when I go to sleep. So if I stop breathing or have a difficulty of breathing, that machine will help me to breathe throughout the night. And when I start doing that, it made a lot of changes. When I get up in the morning, I feel much better because I had a good night's sleep. But if you snore a lot, go and see a doctor. I don't think they can test them here. Philippines and Guam, they do have those machines that they can test you and tell you what level. I'm on level 8. So when I came here, Dr. Llano took my machine and set it up to a level 8 and taught me how to do it. And so that's what I have now. I use the CPAP machine, and there's quite a few Palawans that do kind of heavy or overweight. They have a sleep problems by snoring a lot throughout the night. Go see a doctor, and they'll tell you what kind of machine, or they tell you to get a CPAP machine to help you sleep throughout the night. So I do have sleep apnea problems.
Yes, and it can be a bit uncomfortable, right?
Yeah, the first time I put it on, Dr. Bing, it was very uncomfortable. I feel like, like I'm going to die or something, I mean, I get up in the middle of the night. I'm not used to it, so I just go hold on to my nose and take the whole thing off, and then I start breathing again, because for some reason I had this fear, like, I'm going to suffocate myself to death, but now it's okay. I use it every now and then, but most of the time I just put it aside and I don't use it. But I'm okay. When I feel like I need it, I put it on.
Okay, only when you're not having a good sleep.
Right.
Yeah. But for the mild sleep apnea, it can also be treated with lifestyle changes such as exercise or losing weight or quitting smoking.
Right.
Or if you have allergies, you can go to your doctor for treatment of your allergies. But of course, for moderate or severe, then they would CPAP machine would be beneficial for them, like what you had with you.
Yeah. Well, I think that local doctors can tell you. Dr. Yano sell them for like $400 a unit. It's not it's very expensive. But I think if you go see a doctor and tell your doctor that you're not sleeping well, you wake up in the morning tired and you snore a lot, then I know that it's going to probably recommend that you get a CPAP machine and use it, and that will eliminate your snoring problems.
Yes.
So, Dr. Bing, with that, there's a question about like nasal congestion. How, if you go to sleep with, you mentioned allergies, but if you go to sleep with like a flu or something, will that also affect? Can that also affect your breathing and affect?
Yes, not only your breathing but also your sleep.
Yeah.
Okay, so I have patients who complain of not being able to sleep because of nasal congestion. So we have nasal decongestants. Okay, we can give them, and it might improve their or resolve their nasal congestion and improve their sleep. But of course, it's not instant. It might take a while, and it might take a couple of nights before they will feel better.
Mm-hmm.
And then in terms of chronic stress, so we talk about chronic diseases. It's a prolonged over time. So in terms of stress, chronic stress, how do you know that you're chronically stressed? Is it like an everyday thing, or is it a period of time and then stop and then continue, or?
Well, a little bit of stress is good, just like what we have said before. It keeps you alert and keeps us in focus. But a prolonged type of stress can really be stressful or cause distress, not only with us but also in our relationships. So when we say chronic stress, it means like it's been existing like for several months, or it's been going on for months, and not just like a few days or several days. Okay, it can be going on for months, and you can just imagine, like for people who are experiencing stress for years, okay, when the stress is always there. Like I said, marital stress, an example, would be, let's say there's a case of domestic violence. So you can imagine the victim who's living in that household and experiencing the stress every day.
Mm-hmm.
And then if it's been going on for several months, then that is a chronic type of stress. And if you're continually experiencing it every day for that long period of time, then it can lead to high blood pressure, and it can lead to anxiety, depression. Okay, so that's why we're saying, like, it's not just the physical health that we should be mindful about, but also our mental health. Because stress goes both ways, and can cause physical stress and emotional stress. Okay? So it's very important that we will be able to deal with our stressors and have a good coping mechanism in dealing with these, in order to have a healthy mind and body.
I see. Yeah. Well, I was in the military for 23 years, and you know, it wasn't that easy. I thought I was not able to make it, you know, for 20 years in the Army because I was a single parent, sole parent, with two boys. One is 3, and the other one is 6 and 7 years old. You know, and in the military, so they demand that I do my job, and at the same time, you know, don't neglect your kids by let them stay home by themselves unless they are 12 years old or older, you know. So anyway, I was under a lot of stress, and I had all kinds of health problems, but I solved my problems like this. I told myself to take one day at a time. And don't bring back what happened yesterday. You know, I got divorced 5 times when I was in the military, you know, and I got stuck with the kids, and I didn't know what to do and nobody to turn to. So it's a good thing I didn't turn into drinking a lot of alcohol like a lot of my friends when they ran into a divorce. Then they, instead of get help from a psychiatrist or somebody in the hospital, they went and take drugs and drink alcohol a lot, and some of them are not here today because they left. And then I was able to raise my kids, put them into college, retired, and came to Palau, and now I'm 71 years old, and my life is fantastic. You know, I'm healthy. I'm not a high blood. I don't have any stress problem, but I do have a sleep apnea problem, and I'm working on that by losing weight. So that's my life story.
Well, the military lifestyle.
Yeah. It's very stressful.
Yeah, because you're exposed to you know, environment that usual civilians won't experience in their lifetime, especially when you're exposed to combat.
Yeah.
And of course, the training in itself is very stressful. A lot of trainees drop out and you know, don't make it. So those who make it does not mean that they you know, from that point then everything will be fine, because the more responsibility and the more exposure you have, and the more stress that you will experience. So yes, so it's very important that that's why we're also doing the CISD. I used to work for the Armed Forces of the Philippines and the Philippine National Police. So we do CISD with those who are not just those who are exposed to combat, but those who are you know, who were involved in shootouts, or those who were imprisoned by the enemy, you know, and so we need to debrief and offer critical incident stress debriefing to them, and assess if they are having symptoms of acute stress disorder or post-traumatic stress disorder.
Yeah,
PTSD. So, it's very high stressful job.
Right.
In the military or the police.
Yeah. And you know, when I was only like 17, 18 years old, and when I went to Vietnam, and I served the first 12 months, and after that, you know, I re-enlisted, you know, for another 12 months, so total of 2 years in combat. And I started having these nightmares and lots of problems, mental problems, you know, so I was the #1 candidate for PTSD. But I didn't want to go and see a doctor with my problems, because once they put that, you know, that they put that remarks into your medical file, then they're going to use it against you in a sense like you're nuts. If you go see a psychiatrist, you know, you're no good. You cannot handle anything. They put you to work somewhere else when you don't handle any classified information, stuff like that. So I didn't want to be documented as you know, a head problem child, or they call us, you know, there's a term they use to identify those PTSD people. Once you go and see psychiatrist, you know, then they're gonna mark in your record that you're crazy or something like that, and I didn't want it on my records, you know. So, but still, when I retired, I did a complete physical, and they did not put it in my records. I didn't want them to put it, but I do have a PTSD problem, but I can handle it myself.
Yes, that's the stigma, especially during those times.
Yeah.
But it was actually the Vietnam War that
Right.
where PTSD got the attention that is needed to bring it to the worldwide stage.
Right.
So it was also during that time that they started to treat patients with not just the pharmacological therapy or the psychotropic medications, but also with counseling, yes, psychotherapy. And,
Yeah. They call us all different names, like knucklehead or psycho. They come up with some weird names, so I try to stay away from that. When they start calling me names, so I feel bad, but all I did was distance myself away from them, and I'm okay.
Well, during those times, yes, it's very stigmatized. But nowadays, people are realizing the need for treatment, because the more that they stay away from the treatment and the symptoms get worse, then it could actually lead to developing psychotic symptoms. So the earlier that we get a hold of those with PTSD and be able to treat them with the medication and psychotherapy, then the sooner that their treatment is started and that their symptoms gets better, their condition gets better slowly. Okay, and there might be times that they would still experience the flashbacks, but with psychotherapy and coping mechanisms that they learn from the counseling, psychotherapy sessions, then hopefully they would be able to deal with their PTSD more effectively.
Okay.
So, Dr. Wing, you also mentioned some stress is good. So how does that work? Is it purely to do with hormones and the chemicals that are released? And we hear a lot about this fight or flight system. How does that?
Yes, well, because stress activates your sympathetic nervous system, as we call it, and that is the fight or flight that happens. Okay. So when you're under a lot of stress, then you're exposed in a very traumatic situation. Like when somebody's, let's say, has a gun. So when someone points a gun at you, of course the reaction would be with that of fear and anxiety, and that will activate your sympathetic nervous system, because it's very stressful, highly stressful for you to have a gun pointed at you. So it's either you fight or flight, you deal with it, right? Or you just run away. So that type of stress is, not just frightening, but really stressful. But when I say that a little bit of stress is good, this is like when you're having an exam, okay? Of course, if you're anticipating it, then you would have to study for it. But while you're studying for it, a little bit of anxiety and stress is happening. But it keeps you more focused and aware of what's going on. So it helps you also to be able to remember the things that you are studying. But if you're already too stressed and too anxious to study, then that would be a different thing. So just a little bit of stress and anxiety would be helpful.
Yeah.
Yeah.
Okay. Even when I was in the military, when we go before the promotion board, we study, for like a week before you go to a promotion board. And I experienced a pain right in the stomach, a sharp pain. So I went to see the doctor, and the doctor told me, and said that, when you get nervous, the acid in your stomach for some reason released inside your stomach, and that acid, it's a yellow acid that is really bad for your stomach and cause stomach ulcer. You know, so if you have that for a long time, you know, then you got to see a doctor and they'll give you some medication for it.
Yeah, that would be a chronic stress. But that what you're describing is that of a stress gastritis.
Mm-hmm.
Yeah, so if it's going on for a long period of time, then it can eventually lead to ulcer.
Right.
Yeah.
Okay, well, we got about 8 more minutes to go now, Kafa.
So lang, Dr. Bing,
Very welcome.
can we just remind listeners if they need assistance or if they want to seek any services from the Division of Behavioral Health?
Yes, for those who would want to schedule an appointment with counselors or psychiatrists, you can call up our landline at the BH Outpatient Clinic. It's 488-1907.
Okay.
Thank you, Dr. Bing. Tuloy ka wala ko tamarag ako basal kung waisa sa adol mga niya kung sabihin mo mong igira la sa lifestyle change program.
Yeah, the public health no das with me.
Oh, unfortunately, tala mlora marine sanctuary ingin. So hindi ako.
Okay.
Hopefully next week ang move tan to ka guest again.
Yeah.
Mangkakita daw no kwati mas modi sa gid lifestyle change program sira ko mong daw.
I see. Okay.
Oi, kaman sa let tulig tablas mention rin na last week afar dingora dimle kadeb obsoden. Sige del public health program sa mlo ka ilme magi momlas talk show ri dagi korol tayel program sa ira atrablu lakte. Masya nga imoringi tulig tel adam kodori masing lifestyle change program masya nga atal rakal program weltel sabi nga doctor ya no direct kalngariya program BMT esel ku community health center program ra ministry ra henda direct kalngariya program ringil malat malmalo al program malod yang adal mongil so ang direct kal lol nga sir adal masing katakay sa sir adal ulit ko sing magarang adapta ko ra healthy behaviors ay gayud mongil ablang route ma exercise direct kal magarang manage stress gayud sawatel ra sila gayud ko ra classes so ay nga 26 classes sa pastel mo uling every week the meet so nga ra 1 hour class out meet mo mereka ka 2 months and 3 months mo every other week. So, kung structure del mo niya sel last till 6 months and di once a month del meeting na maklas rigid. Na mararingi ay nga sel kora ko ra program malas mo sila adal lusa 5 to 7% tra weighted fees. So other participants salbol exercise most days of the week self-implementation na CDC 150 minutes ra cardio kora mo ovio ra heart rate. So why you get tilong the first 6 months and so other lose weight and 5 to 7% ra starting weight test mo exercise makada middle once a week in 4 months and then in every other week or 2 months and then I will sell mo second 6 months still ra and so other mo sir at maintain or still weight loss team hindi ka lose talaga na weight kadaway ato kay na sir ato long le may gel still like classes sa rigid kada ngarinya ako ka so dela kasi magarat exercise tra physical activity sa rigid ay gal do ngal lumungi rigid kadol mo sir at masing ngarang awil lokal do nga ako ra nga tips ra mo shopping ang ilgal ako ra budget del rule tringi so buto kay gigi lungis topics tulig el kay nga sir tel ra kay nga sir nga ra gigi del classes so tiang ay nga man lungil program sending ang koram itu tawrera mende gimsal man lungil advertise ringi ma ul magi koram tiang ulit sel time advertise ringi mora blu esel ay nga program sel merigi dar
Arwara maabu lamang ay nga niya udo del sabi del suma ata kukora ang song sa aluul el dakal sel mera class lim lo kit ng borang niya transportation barrier ngin yang mal sab amal kukora mastria gas voucher tir el kukora baby raw ngil sugumato uspe akora akmong ralo uspe el exercise mong mal sab amal maaral more participants may nga amal malulil class ending sel kukora mula sing talra atal ama kora di me pangalit masityamal kamangal time ding sa igidel so atal talra kamang katangara igidel classes tek masyo ngarinya pas rasumpal sa edel morning class edel group kora mora track and field de braille exercise aku kora share recipes ra tulong le may igidel kora almost the support group
must say
igidel program ra CHC amal sabi ay o ay sa group masal sugum kung interested al mura say the lifestyle change program yung mal sa video mo dor officer kama may sign up for kami uling mal ko ra gilel mo 10 al ada ngarawan al class kita sabi eto lo mo uling
mo say hindi ka mama ako mes don lang ngari o ang arbide sa ram ara every Saturday beginning at 6 o'clock there's a group of women come down there and do musical exercise like Zumba. Mga nga sila gera Katolik, direct mandirtin, masesel sa alin brura na Zumba, TikTok, ang kora a combination of both. But a lot of people are, very concerned about their health now, so they start participating. On sa mo kayo sera announcement kami mo organize sa ko nga announcement kami sa Akademia Kelbasiora ang radsil sa telaclon mo telaclon ang adal share ride lengan yan adal atia ride till early in the morning mo sabi ko sa sumida kami mem ko the number and somebody will pick you up and then take you there something like that.
Mas sabihin mo ay say tuli galing baby last time nakatokora mo discourage tra adal da solin mira class nding mararingiya sabi ito lo ay sa atok masaya ling malgira bel exercise tiyaw ngira bringe me mo prevent ta STD mga rang ito kuma aga dila ka bol ready change malubel adapt sa the healthy behavior ang gukira bol sabi ito ngtira bol sa elmas mo makadadi ka ukat sa belong lede emergong yung cell bol ready na yung mal sabi ito ko lang mame ka kisan after still mo tayo the class.
So in other words, it's meet me halfway, it's good for you and me.
Yes, tuloy mahaladik na yun, dahil maskaw maradal ko chlorine sa drains.
Okay.
Sabihin ang Holler Cell Community Health Center, 488-4804. Mga tadura sa Luspia Mira, cellphone niya 775-2807. Di na kasabihin lang ko doon Torakas ngiru ulba tanggel lool May hanggang ating warning 488-4773 and then of course yung hadi available are adi namong dang little den warang 775-1138
I see
at the video mo dong warning aksan as tidak kalmang clear mating warranty.
All right, hey, thanks a lot.
Okay
Sulang tulig adol nakabag chuday gulo ken question malsuma ni adol links
Why say?
Hotel din mo kalau dong lara ate, price sa sumborit.
Balway say still price siyang ako ramal lungil price sa tilog der officer emergency health mas siyang niya auto ila set siya one estate nga niya auto ra alsel ma driver ma alcohol wipes ma sanitizer so siya malungil mas question at gibel mering le tuli galing ako temo geret masay ngarang ako ra sa blol toy sa BL long as iya stress level raw or stress out raw ngarang sa blol toy sa ML mga smoke na uga kamrul enguk ka reduce sa the stress level raw while gilel for and say raw
Okay
so sa blol toy sa BL increase sa stress level raw mas ka stress ngarang sa blol toy sa ML rule enguk reduce malubong lang ayas kasi the stress level raw. Alright?
Okay. Sabela, tamo ko na answer to ko na 1138 mas ka answer wa say?
Why say malubong 488-4601.
Okay.
Ariatan lang ko.
Mabalog sa naman sulang tulig.
Okay, balalo sa bigang have a nice weekend, okay?
Alin na katamal maring sulam madal belam.
Alin na mo basta mo sa kiro ko
Bye, say.
Okay. Bye-bye now.